There were a couple articles that came out this year about how doctors have biases and that those biases can affect the treatment of a patient either negatively, positively, or both. And it seems like most articles are saying that somewhere between 30 to 50% of doctors admit to being biased. So that basically means 1 out of every 2 doctors that you meet is biased towards something at some time related to some person, whether it's an emotional issue, whether it's some type of health issue that the doctor may believe is the patient's own doing, etc. So, you can't really control someone else's bias. You can only really, at the end of the day, control your own bias, right? So, what's the best advice to do? I mean, if you're walking in and 30 to 50% of doctors that you're going to see, which at the end of the day, doctors are people, and I presume that the same rate would apply to nurses and physicians' assistants, etc. So then what do you do to protect yourself from a person who has a bias against you, either because of your looks or gender or religion or whatever it may be? And at the end of the day, I personally believe that education is going to be the key. People really need to take charge of their own health so that they can decide if the treatment that they're getting seems like it might be appropriate or not, and then make a decision based on that. Either seek care elsewhere or bring it up to the physician, whatever the case may be. But if you are not truly your own advocate, then a physician's bias could potentially affect you. So the best way to deal with bias, besides training and education for the physicians on your end, is to be a true consumer. The same way that you go and purchase furniture or bedding should be the same way that you go ahead and choose a physician, so that your belief system sort of aligns with their belief system. Sometimes we don't have a lot of choice. If you're in the emergency room, you sort of have to deal with what you're going to get. I mean, if you have an arm that's dangling at your side, well, then, you're not really going to be able to leave to another hospital. But certainly at that point, you can still take up armor while in that hospital. You can use, most hospitals have a patient advocate system where you can call to speak with someone if you feel that you're not getting the correct care that you need. Some hospitals also have a night person on duty that is responsible to deal with some of these ethical issues that arise. So basically the key for you as the patient is to, number one, what feeling do you get when you're in the presence of that doctor? Do you truly feel that that doctor cares for you? Number two is to arm yourself with information. And number three, every doctor should be giving you at least more than one choice. If you're getting only one choice, that is probably a red flag. So if you're getting one choice, you should probably say, well, what are my other options? What else is available to me? And if you're not hearing an answer, then that should be a sign that either this person doesn't know what they're doing, or that they really want to push you in one certain direction, and you should do your best to avoid that situation. I hope this little piece of advice is helpful, and that it is a benefit to you guys. Anyways, that's me, Edwin Perez from ED Talks, and take care.